Hi, my name is Tim Lai, and I'm a PhD candidate at Auburn University, and I received PhRMA Foundation Predoctoral Fellowships in Value Assessment and Health Outcomes Research. My research focused on the treatment modification for the major depressive disorder, and we know this condition is the leading cause of disability worldwide that impact millions of patients and their family members. But the current evidence shows that even patients initiate their treatment, more than half of them doesn't quite work well, and some treatment adjustment is necessary. However, the current clinical practice, we see there are limited evidence to guide clinical practitioners to try to help patients adjust their medication, and there are also lack of evidence to help us know what patient weigh on the trade-off between those options. So my funded project, I will try to tackle this challenge using the real-world evidence and the patient preferences to identify what treatment strategy is effective and acceptable to patients. Another part of my project, I also want to develop a model trying to predict what is the risk factor for patients who are at risk of the treatment resistance. And the purpose of this model is trying to help clinical practitioners to engage patients who are at risk early on and tailor their individualized treatment plan to increase their treatment adherence. So I think the PhRMA Foundation's their award is very valuable for young scientists like me, because for me, the entire application process itself is already a learning process, because we know that as a scientist, we need to know how to communicate our scientific work to outside audience. So with this kind of application process, we can have this kind of practice opportunity. And receiving the award is also a kind of bonus, because that it will help us know that, okay, our research truly matters. I'm actually an introvert, surprised, and that's why it kind of takes me a lot of time to kind of be prepared to interact with people or talk to people. My advisor, Chad, he keeps pushing me and try to say that you need to jump out of your comfort zone, because my research is all about patient preference, patient engagement. We eventually need to talk with patients to understand them. If we don't jump our comfort zone, then we cannot complete this study. When I complete this project, it's not only the academic growth for me, it's all kind of like also a conquer of my personality to another level. My future career, I would not say fit into a specific positions, because I feel like in the era of AI start to kick in to influence all walks of life, we have no idea what's going on, what job would be drastically modified in the future. So I would say my future goal will still remain that I will engage in the patient-centered value assessment and trying to see whether that AI's impact can help us better improve our study design or better improve our technical skill to engage patients more in our future study.